also with us we have David Perkins, who's with the University of Sydney Broken Hill Department of Rural Health campus.
Mm-hmm.
David, you've got some amazing things happening in the health learning exercise. Can you tell us all about that world-class facility that you run?
Okay, we are providing the clinical training for doctors, for nurses, for social workers, for speech therapists, for occupational therapists, and these are people who've done their classroom teaching in the main capital cities and who are now learning how to do the thing they've trained for. They are working in Broken Hill, they're working in Yindi, in Wilcannia, and in much smaller communities. They're working with local GPs, they're seeing patients for the first time, they're increasingly seeing patients on their own, and we believe, and we're researching to find the evidence, that this provides them with a rural educational advantage. They get better clinical experience and hopefully become better doctors and nurses and social workers than people who've trained in the big crowded hospitals within the city. The next stage is we're trying to increase this from medicine and from health to a much broader set of local needs. We're talking about becoming a community campus of the University of Sydney and having legal studies and business studies, studies in the arts, studies in veterinary studies, and all those people who require practical, community-based training in order to become effective practitioners, good lawyers, good accountants, good business people. And we believe that provides a huge advantage for the city. Economically, it brings in thousands of student weeks. All those students have to eat, they drink, they spend money, they go to the cinema, they're a contribution to the economy, but much more, they're actually providing a service. So students are providing services in our schools, they're providing services in our general practices, in our hospitals. So they're increasing the level of service in a town where it's hard to find practitioners. But we believe that this can be national best practice and this can be world best practice. We have a research team who are collecting the evidence and we're submitting that evidence to international journals, to peer-reviewed journals. So we're trying to provide evidence that with our partners in health and the Flying Doctors, in Murramah, the Aboriginal Medical Service, in the General Practice organisation, working together with our partners, we believe we can provide the best clinical and community-based learning and educational opportunities so that kids in Broken Hill can get the best training possible, but also kids from the city can come to Broken Hill and hopefully they will say, we would like to work here, we would like to live here. We, perhaps not for all their lives, but for a period of time, we can come and contribute to the Broken Hill economy and we will have a good time in doing so.
And tell us if the broadband internet, how is that going to help with, I guess, bring on the amazing work that you're already doing?
Everything you need to learn, all that communication across the world is available through the internet. You can sit in on a lecture from Harvard or from Massachusetts Institute of Technology. You can get those specialists who, let's face it, are never going to be resident in Broken Hill. World's best practice, world's best opportunities are available through the net. Cambridge University, you can go to their lectures, you can listen to their downloads, you can be part of webinars, you can take part in international and in national opportunities. So we provide huge opportunities for people by being connected and by everybody being able to be connected, all the students being connected.
And your rural expertise, of course, can be sent out to those communities around the world.
Exactly. People can download our materials, they can take part in our sessions. When we're doing, for instance, Indigenous cultural awareness training, people can link in and understand what it might mean to work in a Aboriginal community like Wilcannia. They can actually talk to people live in real time who work in these places, who experience in these places. So we create an opportunity for learning and for practical learning that you can't do through the telephone. And that you can even make, get around the time differences. There are all sorts of ways of using this technology to get around the time differences.
David, you mentioned earlier that you've got relationships with students from over 30 universities, and there's a lot of interest in the young ones coming out here to further their learning, and that it was competitive. Can you tell us more about why that is?
One of the reasons it's competitive is because when you come out here, you're not at the back of a queue. When you come out here, you have small numbers of students relating to enthusiastic clinicians, supervisors, lawyers, whoever it is. And people get one-on-one time with experts, and they also get good time with patients or with clients or with school students. We have very good relationship, we have very good access, and people who live in the country are willing to talk about what it means to live in the country. They're willing to talk about their business problems or their clinical problems. So students actually get to practice what it is they're training to do, and to do it with very good quality supervision. Very often back in the city, they're at the back of the queue. There are lots and lots. There might be 80 or 90 students on the course. Here they might be with a group of 12, and there might be 2 of them in each general practice, for instance. So they get a lot of face-to-face time, they get a lot of feedback on how they're going, and people are very generous with their time. And so they get very good experiences. And with every group of students who come, we do feedback sessions where we find out what has been good. And they say what has been good has been being part of the community, has been being in touch with a whole range of people within the organisation where they're placed, is talking to patients and community members. One member of the community takes students down to the river fishing and tells them what it is like to live in the community. So there's a community generosity, but there's also a community expertise. And as we can link that in to national and international expertise, we provide world's best practice. And that's our target.
This amazing project that you have, which is on the verge of being rolled out, subject to resources and funding and so on, it has the potential to totally rework the way Australian regional and rural communities operate, potentially, in terms of not being so isolated anymore, but they can become centres of excellence.
Yeah, that's very much the intention, and we want to submit our programmes and our research to scrutiny, and we do that. We take it to national and international conferences. We travel nationally and overseas. We submit our research papers to first-class national and international journals, because we don't simply want to be people who are talking and talking and talking. We actually want to be people who can demonstrate that our work is first class.
So we have an amazing potential in our region through the endeavours of the health industry and the University of Sydney and your initiatives to increase economic activity in other areas that are not related to health. For example, tourism, creative industries, engineering, and all sorts of other endeavours, purely through the long years of history and experience that you've had in the health industry.
Yes, I mean this is my colleagues. It's not me, but I mean the skills that have been brought up in terms of building relationships within the city mean that if we ask anyone to take a student, we almost always get the answer yes. So if some art students want to come up and we go to the local gallery and say, can you take a student? They'll say yes. If business students come up and we take them to local businesses or to the council and say, can you take a student? They'll say yes. And we have, so the technology that works for nurses, for doctors, the process actually fits very nicely for all sorts of other people, because we're learning that a classroom-based education has its limitations. The key is taking that education out and applying it in the real world. And that has benefits for Broken Hill, it has benefits for the students, and it also has benefits to the kids who live and are educated here. But to do that, we have to be connected. And if we're not connected, then we miss out on all sorts of opportunities that are available to the urban kids.
It's amazing. Who'd have thought that the mining history of Broken Hill could go this way?